This week we're going to be covering Chapter 8. We're going to talk about sleep. I'm going to do this lecture in a couple different smaller lectures, but let's go ahead and let's get started. For this lecture, we're going to be covering sleep and sleep disturbance, describe the physiologic sleep mechanisms. So we're going to talk about the sleep-wake cycle and sleep architecture, and we're going to identify some sleep disturbances that we are going to encounter in the hospital. But look how cute my little Tia is. They are sleeping away. So sleep, well, what is it? Well, it is a state in which a person lacks conscious awareness of environmental surroundings, but they can easily be aroused, so we can wake them up pretty easily. It's distinct from somebody who is unconscious, like in being in a coma or from an injury, so very different. So by the age of 80, we have slept about 24 years if we average 7 hours of sleep per night. Sleep is a basic, dynamic, highly organized, and complex behavior that is essential for healthy functioning and survival. It does influence memory, mood, hormone secretion, glucose metabolism, immune function, and body temperature. We as adults need 7 to 8 hours of sleep within a 24-hour period to be fully awake and alert the next day. Are you getting enough sleep is the question. Then we're going to talk about sleep insufficiency. So this is a condition where an individual does not get enough sleep to support optimal health, well-being, and daily functioning. It can be due to either short sleep duration, poor sleep quality, or interrupted sleep. Think about a time that during the night you just didn't have a good night. Things were waking you up. Like for me the other night, it was my cat. She was out there eating at her food bowl and I could hear her crunching away. Sometimes it's something that we've eaten that will wake us up. A little bit of heartburn, something like that. Chronic sleep insufficiency can lead to cognitive impairment, weakened immune function, increased risk of chronic diseases, such as hypertension, diabetes, and a decreased overall quality of life. Think about a time that you didn't get enough sleep during the nighttime and how you felt that next day. Yeah. So over a longer period of time where you're not getting sufficient amount of sleep, it is really going to wreak havoc on our body. Next is sleep deprivation. So this refers to a condition where an individual does not get enough sleep over a period of time. It can lead to physical, cognitive, and emotional impairments. It can be acute, meaning short-term, or chronic, long-term. So think about a time that you didn't get too much sleep during the nighttime, the next day, how you reacted to something. So I think about driving to work the next morning. Maybe somebody accidentally cuts you off in traffic and you're like, they did that on purpose. Maybe it makes you cry because you're like, how dare they do that to us? It really is just a situation in which usually if we get enough sleep, that wouldn't even faze us. But because maybe we didn't get enough sleep, we're more emotional. So we just think about that. Also, again, making mistakes or not able to remember things the way we do if we get a really good night's sleep and our mind is clear. Sleep fragmentation. This is frequent interruptions or awakening during sleep. It leads to poor sleep quality and inadequate restorative rest. So let's talk about sleep disturbance. This is a broad term that refers to poor sleep from various causes, those such as noise or light, and maybe health-related issues as well, so insomnia, obstructive sleep apnea, or congestive heart failure. There is an estimated 50 to 70 million people in the United States who actually have a sleep disorder that they're unaware of, that they even have this problem. Driving while drowsy is related to 90,000 accidents and 800 deaths per year. It causes billions of dollars in healthcare, work-related accidents, and lost productivity. There are several studies out there that they show similarities between fatigue-related impairment and cognitive and physiologic functioning and impairments due to alcohol intoxication. It's quite the comparison. So there are these participants that they performed these different tests and they were compared under two separate conditions. So after staying awake for extended periods of time, and after reaching a certain blood alcohol. The studies suggested that being awake for 17 hours was very similar to having a blood alcohol concentration of 0.05%. being awake for 24 hours straight is similar to having a blood alcohol concentration of 0.1%. So if you think about the United States, we define legal intoxication for purposes of driving as a blood alcohol concentration of 0.08% or greater. However, driving impairments are seen at a blood alcohol concentration of 0.05%, and some countries actually have their cutoff at that point, or maybe lower for driving purposes. So very, very similar in impairment. Errors that are made in the hospital from lack of sleep or working longer shifts, you want to be very careful about that, because if you do make an error and they found that you were working more than, well, very similar to the 17 hours. So think about doing a double shift or doing a shift and a half. So nurses work 12-hour shifts plus another 6 hours would be 18 hours. So you just have to be very careful and keep that in mind, and especially as students. So I know many of you are working and sometimes prior to clinical. So do you have enough sleep to make decisions to care for patients without making errors? So you just have to be very careful. This can actually place not only you in a liability situation, but also the college. So making sure that you're getting enough sleep before you come to clinical when you're caring for patients. So sleep disturbance related to a couple different factors, and I talked a little bit about them on the last slide, but environmental factors such as noise and light. So if you're working night shift and there's construction going on outside, makes it really difficult for you to get sleep, or light that's coming through, making it also very difficult to get enough sleep. I think about those people who live in Alaska. I don't know how they do it. A lot of blackout curtains, right? Health related, so pain and different sleep disorders. So pain, sleep disorders such as insomnia, obstructive sleep apnea, circadian sleep disorders, narcolepsy, and parasomnias. I already said 50 to 70 million people experience sleep disorders that are maybe unaware of their condition. Patients with chronic illnesses are at the highest risk for sleep disturbances. Untreated sleep disorders can have serious health, safety, and economic consequences. Talked about that a little bit as well. Excessive daytime sleepiness affects work performance, social interactions, and overall quality of life. So just some things that we want to take into account. So as future nurses, it is essential to assess sleep patterns. We want to educate patients on sleep hygiene and also advocate for proper diagnosis and treatment of sleep disorders so that they get plenty of sleep. Next, I'm going to talk about the sleep-wake cycle. This is a 24-hour biologic rhythm that regulates sleep and wakefulness. It's controlled by the brain's circadian rhythm and homeostatic sleep drive. The parts of the brain that are responsible are the forebrain. So we have the cerebral cortex, the hypothalamus, and the thalamus, and then the brainstem. They're all working together to regulate the sleep-wake cycle. So wake behavior. This refers to the physiological and neurological processes that maintain wakefulness and alertness. It's primarily regulated by the reticular activating system, RAS, in our brainstem. It promotes arousal and consciousness. The key components for wake behavior is the reticular activating system, so that's located in the brainstem. It receives sensory input, so light, sound, movement, to keep our brain alert. It works alongside the hypothalamus and the thalamus to regulate consciousness and attention. And then the neurotransmitters are also involved in wakefulness, and I'll talk about that a little bit. So these are the neurotransmitters. They're involved in wakefulness. Glutamate is the primary excitatory neurotransmitter in the central nervous system. It plays a crucial role in learning, memory, wakefulness, and overall brain function by transmitting signals between the nerve cells. We also have dopamine and norepinephrine. These promote alertness and focus. Serotonin and acetylcholine, they influence mood and wakefulness. And then histamine and orexin, or hypocretin. It plays a key role in maintaining sustained wakefulness. So orexin is that primary one for wakefulness. So what affects the wake behavior? Well, Some things that are going to affect it are the circadian rhythm disruption. So, shift work, if you work night shift, jet lag, if you've ever taken a long trip overseas and it's the opposite time of the day, it can really mess with our bodies, even just a few hours. Inconsistent sleep schedules, and then we have medical conditions, so narcolepsy, insomnia, maybe Parkinson's and Alzheimer's. Medications and substances, we know caffeine, stimulants, sedatives, and certain psychiatric medications can also disrupt this wake behavior. And then maybe some lifestyle factors, poor sleep hygiene, stress, excessive screen time before bed. Who is guilty of that one? Let's all raise our hand there, right? So some nursing considerations I want you to think about. We want to assess for excessive daytime sleepiness and possible sleep disorders, so you can ask some questions. Then we're going to educate our patients on the impact of sleep hygiene and lifestyle habits on wakefulness. We're going to monitor hospitalized patients for altered wake behavior because of medications or illness or just being in a new environment. And then we're going to advocate for proper sleep environments, especially for shift workers and ICU patients. Again, sleep is so important for so many things. Let's talk about sleep behavior. It refers to the patterns, habits, and physiological processes that regulate sleep onset, maintenance, and quality. It is influenced by biological, psychological, and environmental factors and plays a critical role in overall health. Our hypothalamus contains many of the sleep-promoting neurons. These neurons inhibit the ascending reticular activating system and promote sleep. So here are the neurotransmitters and peptides that they all promote sleep. The one here is GABA, so it inhibits brain activity to induce sleep. And then we have ghrelin, growth hormone releasing hormone, delta sleep inducing peptide, prostaglandins, and pro-inflammatory cytokines. So just a couple facts about these neurotransmitters and peptides. So with infection, the pro-inflammatory cytokines actually cause sleepiness and lethargy. With digestion, the peptides released by the GI tract after food ingestion cause sleepiness, also known as postprandial sleepiness. So think about a time that you've eaten a big lunch. After lunch, you always end up feeling a little bit tired. Think about Thanksgiving when we're eating the turkey, the mashed potatoes, the gravy, all of those trimmings, and afterwards we're ready for a nap. So that's what's happening with that. Melatonin. This is made by the pineal gland and it's secreted based on light-dark cycle. The release of melatonin, typically in the evening hours, turns off the wake behaviors and promotes sleep. That's why a lot of us like to take melatonin at nighttime to help promote that sleep. Next are the circadian rhythms. These are 24-hour cycles that are a part of the body's internal clock, regulating various physiological processes, including the sleep-wake cycles, body temperature, and hormone secretion. The rhythm is controlled by a suprachiasmatic nucleus in our hypothalamus. It responds to light cues and helps synchronize the body's processes to external environment. So how can we disrupt these circadian rhythms? Well, jet lag, night shift work, and sleep disorders. And I kind of covered that a little bit. Next, we're going to talk about the sleep architecture. And I'm going to go into both of these, but there are two stages: non-rapid eye movement, NREM, and then the rapid eye movement, REM. So let's talk about each one of those. So when we talk about the non-rapid eye movement, NREM, there are 3 stages involved. So we have N1, so that's stage 1, light sleep. Usually a duration here is a few minutes and then we're off to sleep. Some characteristics, so we transition period from wakefulness to sleep. The body begins to relax and the heart rate and breathing start to slow down. People in this stage may experience some sleep starts or sudden muscle jerks. If you've ever just started falling asleep and all of a sudden you just jerk awake. Brain activity at this point, the brain produces alpha waves, slowing down active thinking to a more relaxed state. And then N2, which is that stage 2, we get into a deeper sleep. The duration here is around 20 minutes. The body temperature drops, heart rate and breathing become more regular, and the body enters a state of deeper relaxation. This stage accounts for the majority of the time that we sleep. The brain activity here, so the brain produces sleep spindles. They're short bursts of rapid brain activity, and K complexes, which are large high voltage waves, which are thought to protect sleep and aid in memory consolidation. So that's what that stage 2 is all about. We talk about N3 or stage 3. This is that deep sleep or slow wave sleep. Duration here is about 20 to 40 minutes in the first sleep cycle. Some characteristics: the body is in its most restorative state. Growth hormone is released, and the body repairs tissues, builds bones and muscle, and strengthens the immune system. The brain activity, this is characterized by slow delta waves. So we're going to see those high amplitude, low frequency waves on the EEG if we did one. This is the stage where sleepwalking and night terrors can occur. This stage will decline with age, so most adults over 60 have very little N3 sleep. So again, like I said, we spend about 75 to 85% of sleep here at NREM. With rapid eye movement, or REM, so this accounts for 20 to 25% of sleep. Sleep here usually occurs about 90 minutes after falling asleep and lasts for about 10 to 20 minutes in the first cycle, so with the duration increasing in later cycles. Characteristics of REM is associated with very vivid dreaming and plays a role in memory consolidation, mood regulation, and cognitive function. The body is paralyzed to prevent acting out dreams, and the brain becomes more active. So on brain activity, we're going to see waves similar to those seen when somebody is awake. So low amplitude, mixed frequency. The eyes are moving rapidly under the eyelids, hence where they get the name rapid eye movement. Muscle atonia, so this is REM sleep is accompanied by a temporary paralysis of muscles, except for essential muscles like the diaphragm and eye muscles. Last, I'm going to talk about sleep disturbances in the hospital. First, noise. So a lot of patients will say, I thought there was a party going on out there at the nurse's station. I heard so much commotion going on. So remember, keep your voices low. Alarms. We get fatigued from all the different alarms going off. So if your patient's alarms are going off, please respond to them quickly. As students, of course, you can't go in there and turn off an IV pump because you'll get in trouble, but you do want to get somebody in there and get that taken care of pretty quickly. Again, it can be very annoying and it can disrupt somebody's sleep. Light, medications. So think about all the different medications these patients are on. Disruption, so we're coming in and out of their room and we're taking vital signs and we're giving medications and we're talking to them about all these different things. So if we can group our care sometimes and give them big chunks of time to rest, that's important. Illness, we talked about how that can disrupt sleep. Inactivity, boredom, and napping during the day all can disrupt patients' sleep. What else is there to do but to just lie in bed in there? So if we can give them some activities and help them keep awake during the day and then sleep at night. Remember, you as the nurse play such an important role in patient sleep, and we know how important sleep is for healing. So we want to make sure we're doing all the things to help promote that. I know at Inlow there's either baskets or carts that have different things on them to give the patient. So sleeping masks, we have earplugs, sleepy time tea. There's door signs that say don't disturb during this amount of time. So we can just help do our part for our patients to help promote the sleep. All right, that ends this section for the lecture. Go ahead and go on to the next one.